and welcome to everybody. It's wonderful to see you again. It's been some time. I think our last session was last year. So welcome back to our community of practice. We're excited to bring you our 8th session. The topics today will be an update to the technical note on prevention and control measures for managing suspected and confirmed cases of COVID-19. And that will be presented by Lillian Barros of Anvisa. And then we'll have 2 presentations on progress made at 2 hospitals. The hospitals are the Hospital and Emergency Room for Children in the South Zone and the State Hospital in Villa Alpina. And this will be presented by Evandro Pinheiro and Juliana Carvalho. Some reminders for you that interpretation is available in Portuguese and in English. And you can access that by clicking on the interpretation button and choosing the language. Please use the chat box at any point. We'll be monitoring that, and you can use the chat box to ask questions about the presentation, or you can also use it if you're having any problems with IT or logistics. During the Q&A sessions, and we'll have 2 Q&A sessions today, please use the raise hand option if you'd like to have access to your microphone, and we will unmute it so you can ask a question or make a comment. And as a reminder, these sessions are recorded, and by attending, you consent to be recorded, and links to the recordings will be sent out. And finally, there are certificates of attendance, and they'll be available for each session through a link in the chat at the end of the session. So we'll give you a reminder to please click on the link in the chat box and complete a brief survey to obtain a certificate of attendance. And last, the Project ECHO collects registration, participation, chat, comments, and poll responses for this program, and they're shared with CDC and USP. Your data will be de-identified and kept confidential, but just want you to be aware that these data may be used for reports, communications, surveys, quality assurance, evaluation, and to inform new initiatives. And with that, I thank you all. Again, it's wonderful to be back. And I'll hand it over now to our next speaker. Thank you. And that's Milton Latchik. It's over to you, please. Thanks.
Thank you. Sejam todos bem-vindos.
Thank you. Welcome, everyone, to our new session on March 21st, 2021, our Enhancing Infection Prevention and Control to Respond to COVID-19 in Brazil. The first topic in our agenda is our polling questions. So we ask you please to reply to our polling questions. We're going to have some time to answer the questions. Don't click on the X to close this pop-up, please. I'll read the question and then you have from 1 to 2 minutes to answer the question. So the first question is, in order to monitor signs and symptoms in your hospital, which of the following options described above are also checked during monitoring, in addition to the common signs and symptoms like fever, cough, and shortness of breath? This is a multiple choice question. You have from 1 to 2 minutes to respond.
Então, é uma questão relacionada a monitoramento.
So this question is about monitoring of the common signs and symptoms, and which of these other options do you include in your monitoring?
Ok. Bom, acho que a gente pode, antes de passar para o próximo, a gente
Okay.
observa um predomínio, né, de
Before moving on to our next question, we see a predominance here of partial or total loss of smell, and then runny nose and headache, as signs and symptoms to monitor. Great, let's move on to the next question.
Ok, já vimos os resultados, a gente pode passar
Okay,
para...
those were the results of the first polling question. Let's now move on to our next question. At your hospital, from the moment a patient arrives at the entrance, do all patients and family members get a clean surgical mask to wear? A, all patients and family members, regardless of the signs and symptoms they present, or B, patients and family members with any types of symptoms will receive a mask, but the patients and family members that do not present any symptoms do not receive a mask. C, only patients and family members with respiratory infection or respiratory symptoms like cough, runny nose, shortness of breath, and etc., only those will get a mask, or no patient or family members and friends get masks, or E, other, or F, I don't know.
do fornecimento de máscaras
So
cirúrgicas.
now this is about whether you provide a clean surgical mask to patients and family or friends who accompany them when they arrive at your hospital. Please answer.
Só mais alguns segundos, acho que todo mundo já praticamente se
Just a
manifestou.
few seconds left. I think everyone has responded. Let me see your answers now.
Ok, então parece assim que todos
There we go.
os pacientes e acompanhantes
Apparently, all patients and family members get a clean surgical mask at the entrance of the hospital, regardless of the signs and symptoms they present.
com maior frequência, né, que ocorreu com maior
So
frequência por parte
that was the most voted option from you. Now, a group of people also said that patients and family members with all symptoms get masks, but patients and family members that do not present symptoms don't get masks. A few of you also chose C. So during our discussion today, I think it's important to talk about this topic, but at first, looking at the results, choice A got most of the responses.
Ok, podemos passar para o próximo.
35% of the responses, to be more exact. Next question, please.
No seu hospital,
At
quando
your
é
hospital,
realizada a reposição
when do you replenish a 70% alcohol-based hand sanitizer in wall dispensers or totems? Before the product has finished in the dispenser or totem, or B, you replenish it immediately after the product ends in the dispenser and totem? C, the replenishment doesn't happen immediately after the product ends in the dispenser or totem? D, we find it hard to replace this product in the dispenser or totem in an agile manner? E, others. F, I don't know. So you have 2 minutes to answer. When do you replace your 70% alcohol-based hand sanitizer and wall dispensers or totems?
Ok, eu acho que todo mundo
Right?
já se manifestou.
I think everyone has answered the question already.
O que a gente observou como resposta mais frequente.
The most common answer chosen was that the replenishment is done immediately after the product ends in the dispenser or totem. So 33% of you chose letter B, but also many of you chose letter D. We find it hard to replace this product quickly in the dispenser or totem. 29% of you chose this answer. So this seems to be a problem to be solved. You know, replenishment, management of hand sanitizers. This is really important. Okay, next question.
Ok. Podemos passar para a próxima pergunta.
Next question, please.
São só essas 3 perguntas, Milton.
I think these were all the questions we had. Okay, so we close our polling questions. I'm sure we could have a better management of these issues. We can have a technical discussion about that, and that's what we're going to talk about today during our conversations, and we can also open a discussion forum after today's session. So now I would like to invite Lilian de Souza Barros from Anvisa. She's going to give us an update on the technical note 04/2020, guidance for healthcare services, prevention and control measures that should be adopted when caring for suspected or confirmed cases of COVID-19. Lilian is from GVIMS, GGTs, and Anvisa. So Lilian, can you please introduce yourself before you start your talk?
Muito obrigado, Milton. Boa tarde a todos.
Thank you, Milton. Good afternoon, everyone. I would like to thank the organizers for the invitation to take part in this webinar, which is a very important one for the Previ-COVID project. So thank you very much. I am a pharmacist by background. I worked in hospitals for 11 years, 6 of them in small-sized hospitals, in which I was a consultant in the Infection Prevention and Control Commission, and I also worked in a large-size hospital for 5 years. So I know these 2 different realities. I also have experience in registration and post-registration of drugs. And now, as Milton said, I work in the management of surveillance and monitoring in healthcare services, or GVIMS, as Milton said. Now I'm going to start sharing my screen.
Vocês conseguem ver?
Can you see my screen?
Sim, estamos vendo, Lilian. Só precisa
Yes, we can see it, Lilian. You just should put it on presentation mode.
Agora foi?
Sim,
Ok,
agora foi,
foi.
tá ótimo.
Yes, it's working now.
Bem, como eu disse, eu trabalho na
Okay, so
Gerência de
as I
Vigilância e
said, I
Monitoramento em
work
Serviços de
at the
Saúde, que é mais
Surveillance and
conhecido como
Monitoring in
GVIMS,
Healthcare Services
e a nossa gerência
Management
ela atua
Center, or
como coordenadora do
GVIMS.
Programa
And
Nacional de
this is
Prevenção e
actually the
Controle de
coordinator of the
IPIs, né,
National
infecções relacionadas à
Infection
saúde, mais conhecido como
Control
NPC,
Services for
e como
healthcare
coordenação
related
nacional, nós
infections.
fazemos parte
And
do
as the
Sistema
national
Nacional
coordinator,
de
we are
Vigilância
part of the
Epidemiológica das
National
IAs,
Service
que
or of
conta também com a
epidemiological
participação das
control of
comissões, né, por
healthcare
exemplo,
related
comissão para,
infections. And
CCIHs,
we are
as
also
comissões
part of the
municipais e as
infection control
coordenações
commissions, or
estaduais de prevenção e
CCIH,
controle de
as
infecção,
well as the state
nós
and
conhecemos como
municipal
CCIs.
hospital
E
infection
o
control
papel das
centers.
CCIHs dentro desse sistema
The
de
role
vigilância é
of
um papel muito importante,
CCIH
porque
in
além de
this
todas as
surveillance
várias
system is a really
atribuições que a
important
CCIH
one.
tem,
In addition to
a
all of
CCIH
the
também
responsibilities
alimenta
that
esse sistema com os
CCIHs
dados de
have, we
infecção.
also feed the
Nós, como
system with
coordenação nacional de
infection-related
epidemiológica,
data.
analisamos
We
esses
are the
dados
national
e
coordinators,
eles
so we
nos
get the
ajudam a
data, we
direcionar
analyze the
ações
data,
nacionais.
and this helps us
Né? Então, eu
inform
gosto sempre de trazer
national
esse
actions.
slide para
So I
mostrar
really like
que
to share this
prevenção e
slide
controle de
to
IPIs,
let
que eu
people
vou
know
chamar de
that
PCI,
uh,
para facilitar,
infection
é um trabalho em
prevention
conjunto
and
em que
control of
cada
hospital
desses atores tem
related
suas
infection is a
atribuições,
joint work,
né?
and
Então, pensando
each
nas atribuições da
organ
Anvisa,
has a different responsibility.
nós
Thinking about
publicamos uma
Anvisa's
série de
responsibilities, we
documentos
published
para
a
orientar os
series of
serviços de
documents
saúde
to
em
provide
relação
guidance
à
to healthcare
prevenção e controle de
institutions when it comes
infecção
to
no contexto do
infection
novo
prevention
coronavírus.
and
E um dos
control
principais
for
documentos que nós
the new
publicamos foi essa
coronavirus. And one of the
TC4
main
de
documents that we
2020,
published was technical
né?
note number
E aqui eu
4,
estou
dating from
trazendo
2020.
uma linha do
And
tempo em
now
relação
you
às
can see a
atualizações dessa
timeline of
estratégia,
the
porque ela já está na
updates to
sexta
this
atualização,
technical note. This is
que
actually
foi
the sixth
publicada
update.
no dia 25 de fevereiro do mês
It was
passado, então já
published
está
on
fazendo um mês,
February
né, dessa
25th,
publicação.
so a
E
month
nós
ago.
estamos desde o início acompanhando as
And
notícias em
since the
relação a
beginning,
esse novo
we are,
coronavírus e nos mobilizando.
updated on the
E
news
em
about the new
meados de
coronavirus
janeiro, a
disease.
Organização
And
Pan-Americana
in
da Saúde, ela
mid-January,
publicou um
the Pan
alerta em relação
American
a esse novo
Health
coronavírus.
Organization
E
published
nós
a warning
pegamos esse
about the new
alerta, assim como o
coronavirus.
boletim
And we
epidemiológico
got
do
this
Ministério
warning
da
as well as the
Saúde e
epidemiological
encaminhamos
bulletin of
para
the
as
Ministry of
coordenações
Health. And
estaduais,
we sent out to the state coordination
também
centers,
solicitando que elas fizessem alguns levantamentos em relação às
asking
questões
them
do leito de
to
UTI
conduct a few
para
surveys about
mobilizar
hospitals that had
as
ICU
coordenações estaduais.
beds
E nesse
to
intervalo, nós
mobilize
estávamos
these state
elaborando a nota
centers.
técnica 4,
Meanwhile, we
que foi
were
publicada pela
already
primeira vez no dia
updating
30
or
de
working
janeiro de
on
2020.
this technical note
A
number
partir
4,
daí,
which was published
sempre
on
que
January
novas evidências
30th,
científicas
2020
eram
for the first
publicadas,
time.
ou então
Ever
que nós
since then, whenever
identificávamos
we
algum
had
ponto que
new
precisava ser
scientific evidence
discutido na
published,
nota
or whenever we
técnica, ou
found
éramos
any
demandados
specific
para
issues
tratar
to be
de algum
discussed in
assunto,
the
nós
technical note,
revisávamos essa nota
we would
técnica.
review such
Sendo
technical note.
que a partir dessa revisão de março, né, de 21 de março,
So
que foi a segunda
after the
atualização,
update
nós
on
recebemos
March
apoio de alguns
21st,
especialistas,
2020, so our
representantes de
second
sociedades
update, we got the
científicas,
support of
né,
some
para nos
experts,
ajudar na
representatives of
discussão técnica
scientific
dessas revisões
societies that
da
would
nota
help
técnica.
us
A
in
princípio eram
performing the
3
technical
sociedades
discussions
científicas
of the
representadas,
updates of
mas
the
isso
technical
cresceu.
note. At
Atualmente nós
first, we
temos
got the support of
cerca de
3 different
20
medical
sociedades
societies, but now
científicas
we
que
actually have
nos
about 20
apoiam nessas
scientific
revisões da
societies
nota técnica
helping us
4
review
e
technical
também
note
das outras
number
notas
4
técnicas.
and
Esse é um,
all
um
other
trabalho de
technical notes.
colaborativa.
This is what we call a
E
collaborative group.
aqui também nesse slide eu destaco a questão da
Here on
publicação
this
da nota
slide,
técnica
you can
6 de
also see
2020,
a
que ela
highlight
é
here of the
complementar essa
publication
nota
of
técnica
technical
4,
note
que
number
ela vem
6
trazer
from
informações
2020, which is
exclusivas
complementary to
relacionadas a
technical
procedimentos
note number
cirúrgicos.
4.
E a
So
nota
it's talking
técnica
about
7 de
IPC
2020 vem trazer
regarding
informações
surgical
a
procedures.
para
And
prevenção
also
dos
technical
surtos
note number 4,
por
talking about the
SARS-CoV-2 em
prevention of
serviços de saúde. Essas
SARS-CoV-2
duas notas técnicas
outbreaks
também
in
são muito
healthcare
importantes e elas
institutions.
são
These two
complementares
technical
à
notes
nota
are
técnica
also very
4.
important, and
E
they
aí nós
complement
vemos que
technical note number 4.
a última
So the last update before this one happened in October last year. So it's been a while since we last revised the technical note, and considering the new scientific evidence and new strains that arose, we reviewed the technical note once more to see whether these new strains would affect our recommendation related to infection prevention and control. So here you can see the main changes in the last update of technical note 4. We made several changes to improve the how understandable the technical note was, and we also included a few things that I'm going to highlight to you. In the introduction, we started talking about the new variants or strains of SARS-CoV-2. In a simplified way, we know that mutations are natural events that are part of the evolution of a virus. So this was already expected. Most of these mutations, however, do not cause an epidemiological impact. However, some of them will bring some selective advantages to the virus, such as increasing transmissibility and increasing the severity of the disease, the mortality, and these are monitored by the World Health Organization, and they are considered variants of concern. So in our technical note, we mentioned 3 of them more specifically, but there are others already. So it's been a month since our update was published, and this is quite dynamic, as you know. So we mentioned 3 of them. And so it's variant B117 that was first identified in the UK, but it has already spread and it's already been seen in Brazil. So this variant is related to an increase in transmissibility and severity of the cases. There are papers talking about how this variant is more lethal. And also variant B1351 from South Africa is already circulating in Brazil, and it's related to an increase in transmissibility. And they've also been talking about another concern of its ability to affect the immune system, and that can have an impact on the efficacy of treatments, of vaccines, and the possibility of reinfection. And then finally, we have variant P1, which was notified to the World Health Organization in last January. And it's related to an increase in transmissibility, as well as its ability to affect the immune system because of where the mutations happened.
Nós também tratamos nessa nota técnica em relação à
This
reinfecção.
technical note also deals with reinfection. This is a concept that is present in the Ministry of Health guide. So we wanted to increase the awareness of healthcare systems about the possibility of reinfection. Up until the 25th of February, when the technical note was updated, we knew only 6 cases confirmed by the Ministry of Health, 6 cases of reinfection, but we know that many more could have happened. So we wanted to include this in the update of the technical note, because previously we said we had no confirmation of reinfection cases, and now we had that confirmation. So our question is this a consequence of the limited and transient protective immunity, or does it reflect the ability of the virus to prevent immunological responses? So we wanted to draw attention to the topic of reinfection. Then we also talked about prevention measures considering the new variants. So we talked to all the employees and the National Commission of Hospital-Related Infections to talk about the new variants and also the other recommendations regarding the use of masks. Some of them were recommending wearing 2 masks. Other countries were not recommending fabric masks, only surgical masks or above. So in this discussion, we reached a consensus, Anvisa and the scientific society, and about the recommendations described in the technical note, when applied correctly, were effective. So we also wanted to reinforce the need of wearing the masks correctly, because we know that oftentimes this is not what happens. So what does it mean to wear a mask correctly? Well, you should wear a mask covering your nose, your mouth, and your chin, and it should fit your face. And also, it should always be clean and dry. We also reinforce the need to intensify prevention measures considering the increase in healthcare demand.
Considerar as medidas descritas na nota técnica.
So considering the measures that were described in the technical note, reinforcing the need to wear masks correctly, and also emphasize the need to practice hand hygiene and social distancing. And we also drew attention to the role of managers that should make sure we have all the conditions to implement infection prevention and control measures, and to train professionals, increase their awareness, not only of healthcare professionals, but also patients and the population in general, and improve stock management measures. So summing up, we do not recommend wearing 2 masks. We continue recommending wearing 1 single mask. And we continue with the recommendation of fabric masks in specific cases. Now, at the triage at the healthcare service, we reinforce prevention measures to patients and family members. We talk about the correct use of masks. The masks should fit your face well. It should be whole, clean, and dry, and cover your nose, mouth, and chin. But 1 single mask and not 2, not necessarily 2. And we should wear masks and combine that with hand hygiene and physical distancing. About surgical masks, we included a sentence. Oh, sorry, that's in the next slide. So about the use of surgical masks by patients that have respiratory symptoms. So we reinforce the need of wearing surgical masks, not only of the patients who have respiratory symptoms, but also their family members, because if you have contact with a patient that has respiratory symptoms, you should also wear a surgical mask. Now, about wearing fabric masks. Well, we made that clearer in our technical note, saying who can wear fabric masks. So professionals that work in administrative or management areas only, and that have no contact with patients, and that do not walk around healthcare areas. So we added this because you can have someone, that works in an office, but that needs to move around, places in which patients are present. So in that case, the employee should wear a surgical mask and not a fabric mask. And we also changed the recommendation on the type of mask to be worn by front desk and security professionals. So before we said that if those professionals were not in contact with patient in less than 1 meter away, they could wear fabric masks. But now we're saying that they need to wear surgical masks. And why is that? Well, because we realized that it's really hard for these professionals to keep the distance to patients. They are right there at the front entrance of hospitals. So it's hard to keep a distance from patients. So front desk professionals and security guards should also wear surgical masks as well as ambulance drivers. In the previous note, we said that if the driver does not have contact with patients, and if there is a physical divide between a patient environment and driver environment, then drivers could wear fabric masks. Now, this is no longer our recommendation because we also think it's very hard for this professional to keep their distance from patients. So they should also wear PPE that match the risk of their job. So Lillian, you have 2 minutes, okay?
Tá.
I'm sorry to interrupt. You have 2 minutes left. Okay, I'll try and be quicker. We also included a recommendation to wear surgical masks. We said that you could actually tie a knot to fit the mask to your face better. This is an infographic that is present in technical note number 4, illustrating all professionals that need to wear a fabric mask, a surgical mask, or an N95 mask. So for surgical masks, we now have ambulance drivers, patients with symptoms, front desk professionals, and security guards. Now, this infographic was added because we get a lot of questions about what type of PPEs professionals should wear while providing healthcare. So we have here PPI for when you have known aerosol generation procedures and those with. So with aerosol production, you add a hat and you wear an N95 mask. Now about the aprons, when do you need waterproof aprons? Whenever you have contact with any fluids or secretion. Now, attachment 2 talks about dialysis. So we reinforced the issue of family members. They should only be there if it's extremely necessary to decrease the flow of people in the healthcare centers. But if the patient has any types of symptoms, we recommend that they do not go together with the patient to dialysis. And we now added something about making surgical masks available for dialysis for suspected or confirmed cases and patients with respiratory symptoms, as well as family members that are there accompanying a patient with respiratory symptoms. These people should also wear a surgical mask. Now we excluded the recommendation saying that in collective offices, we would give preference to one patient at a time. Now we prefer to focus on air and ventilation, and then healthcare centers could define the flows and service protocol. Now, attachment 5, how to care to a dead body. We updated the management of dead bodies outside healthcare centers. The Ministry of Health published the second version of their guide in December last year. So we updated our technical note, and we also improved the initial text phrasing because it was still unclear what the management should be. It's different for when you manage a dead body that has already fulfilled the criteria to get out of isolation, and patients that were still within isolation criteria when they died. So attachment number 5 is a know about the recommendations for patients that were still, under isolation. Those that were not can follow the normal flow of the hospital. So this is only a summary of the main changes that I have already mentioned. And this is where you can find these publications on our website. Our website has changed, so this is where you can find a COVID-19 tab, where you'll find all of the current technical notes as well as previous versions. Finally, I'd like to thank all of those who helped us to update this technical note, all of these scientific commissions and societies, universities, technical areas of the Ministry of Health, and the state and municipal centers of infection prevention and control, commissions of hospital-related infection prevention and control, as well as all the healthcare professionals who are in the front line saving lives every day. This is our technical and administrative team, and now I'm available for questions. Thank you, Lilian. This was an excellent presentation. We have 5 minutes for questions and comments. Just as a reminder, you can ask your questions in writing in the chat box. Lilian, I'd like to hear your opinion on something. I know we haven't reached a consensus on this yet, but what's your view on the current situation of the COVID-19 pandemic in Brazil, considering the occupation rate of hospitals? We've been experiencing a collapse, almost a collapse of the healthcare system, and more specifically, the hospital network. So what's your take on the impact this has on hospital-related infections, as well as transmission of COVID-19 within hospitals? Thank you for your question, Milton. That's a very important question. We saw a major impact of the pandemic last year on the infection data. Healthcare centers are overwhelmed. They have a lot of work to do. Also, the infection control coordination centers are overwhelmed. They have lots of work to do, and the pandemic intensified their work even further. So we saw the data in 2020. This was a very atypical year. In some cases, we were not notified of all the cases, so we actually ran a campaign to improve reporting or notification. And we saw overcrowded hospitals. Unfortunately, this is now a reality throughout the country. Previously we had states that were overcrowded, but they could send patients to other states. But now apparently all states have long waiting lines. I'm in Goiás, and last week we had 300 patients waiting for an ICU bed. So this has an impact on the mortality rate as well, because if it takes you long to provide service or to intubate a patient, that can have an impact on their mortality. But our hope comes, from vaccines. We are hopeful with the vaccination, and we need to increase the number of people vaccinated. That's the way to see an improvement in this scenario. But unfortunately, in recent days, we hit a horrible all-time record And our hope is indeed in vaccines, scientifically proved drugs that can prevent COVID-19 infection. Okay, thank you, Lillian. We can answer 2 more questions. You can write them in the chat box or say them out loud if you want. I have another question for you, Lillian. Some food for thought. I'm sure other people have the same question as I have. So in order to detect new variants of the new coronavirus, circulating in different states with well-documented cases of these new variants, do you think this is going to change the infection prevention and control practices and the service provided to patients and to the population in general? Well, Milton, we discussed this topic in depth, and the basic recommendations have not been changed in the technical note. We did change the recommendation on the type of masks to be worn by certain types of professionals, but the basic infection prevention and control measures remain the same. So these new variants are still being studied. So it might be that we have dramatic changes in the recommendations, but for now, we haven't yet changed these recommendations dramatically. We're still waiting for the World Health Organization statements. We use their documents as a basis for many of our own documents. So we're still waiting to hear from them, but for now, no major changes. We'll wait for the next scientific evidence publications to happen. Publications, sorry. I think Milton is muted. Milton, I see that we have a question here in the chat. Did you see it? Yes, I saw it. So we have this question in the chat for Lillian. So there are actually 2 questions here. What is your management for healthcare professionals with suspected COVID-19 in their context they had at home or at work? And do vaccinations of these professionals change any of the recommendations when you see a case like that? Okay, thank you for your question. So about healthcare professionals' health, we have representatives of the Ministry of Health and worker health members participating in our discussion of the technical notes, and we address this issue on technical note number 4 when we mentioned outbreaks. So we decided not to talk about healthcare professionals' health in technical note number 4 because the Ministry of Health has documents about it, more specifically talking about it. But our recommendation is that hospital managers are aware of the possibility and is sensitive to whenever a healthcare professional presents with symptoms. And the recommendation is that this professional goes into quarantine. You should isolate this professional, check whether the professional is still transmitting the disease to go back to work. But we haven't talked about it in technical note number 4. Okay, Lillian, now another question. Do you recommend testing patients and on dialysis, especially, after a hospitalization and when the patient is going back to dialysis, thinking about a patient with chronic kidney disease that might need hospitalization, and then when they're going back to dialysis, do you test them? What is your recommendation on testing these patients after they've been hospitalized or they've been submitted to any specific healthcare procedure? Thank you for your question. Just adding to my previous answer, I recommend reading technical note number 7, dating from 2020, which will give you many recommendations on how to prevent outbreaks in healthcare centers. Now, about testing patients on dialysis. We talked about it on technical note number 4. We actually included a paragraph saying that testing a patient that does not have symptoms is a very challenging surveillance measure. And why is that? Because if the patient has no symptoms, and all tests are based on the onset of symptoms. So if you test asymptomatic patients, that is quite a challenge. I'm sorry. So you might be testing a patient and the patient just had contact with an infected person 1 or 2 days ago and has had no symptoms, and the test will then be negative. So we said that if you want to perform this type of surveillance, you could do that, but that's quite challenging. Because if the patient is asymptomatic, you don't know for sure what is the right date to test the patient, right? You don't know when the onset of symptoms were. There was no onset of symptoms, right? Right. Thank you very much, Lillian, for your participation. We want to continue having other technical discussions throughout our events. So now I would like to invite our next speaker. We're going to have 2 talks now of hospitals that are participating in this project. Pre-COVID BR, progresses achieved in hospital of children of Zona Sul. So Evandro Nascimento Pinheiro works at the hospital and ER of the Zona Sul Hospital. So Evandro, can you please introduce yourself? And then you can move on with your presentation. Thank you very much. Good afternoon, everyone. I would like to thank you for inviting me to take part in this project. My name is Evandro, and I joined CCRA when the pandemic started. So for a year now, I'm a specialist in emergency management and innovative projects. I am a member of the commission of the Children's Hospital of the South Zone. Can you please share my presentation? Because I'm on my cell phone. Sure, I'm going to share my screen. Please let me know when you can see it.
Por enquanto ainda não, viu, Julia?
Ainda não, Julia.
Agora começou.
Okay, there we go.
Pois bem, dando continuidade à série de diálogos, a apresentação dos progressos dos hospitais.
So I'm going to present the progress of the Children's Hospital and ER in the South Zone of Manaus. Just you should just put it on presentation mode, Julia.
Você já pode passar para o próximo slide, por favor. Obrigado. Dando continuidade Bom, o
So,
Hospital de Pronto-Socorro da Criança Zona Sul é uma instituição pública.
this is a public healthcare institution that provides urgency and emergency pediatric service. It works 24 hours a day. It is located in the city of Manaus on Cottajas Avenue with an installed capacity of 106 beds with spontaneous and referred cases. The specialties that we provide, our clinical staff has pediatricians, surgeons, anesthesiologists, orthopedics, intensive care professionals, nephrologists, intensive care nurses, urgency and emergency nurses, physical therapy, psychology, nutritionist, and speech therapy.
Bom, a nossa equipe é composta, a equipe da CCH é composta por
Our CCIH team has a physician, a nurse, a nursing technician, and 2 interns. And we have Diana and Raquel, our technical and scientific supports. So our mission is to avoid and reduce the number of hospital-related infection, promoting the health of all people that come to our institution.
Os nossos leitos são
Our
divididos por
beds are divided in age brackets. So you can see there, infirmaries, children for 7 months to 2 years of age. And we also have 4 urgency and emergency rooms, 9 observation beds, and 18 observation beds as well. So 15 ICU beds, 5 for COVID, and 10 for other types of diseases. In the last 6 months, we had about 3,933 services at our hospital, with a peak in December of 2020, and then a drop in February 2021. Of the healthcare professionals infected with COVID-19 at our hospital, in 2020, there was an increase starting in April or May. That's when we had the peak of the first wave in the city of Manaus. And that affected mostly females. And then in 2021, the profile changed. You know, male professionals were most hardly hit. So we had a significant number of male professionals infected in our unit. In total, we have 498 healthcare professionals already infected at our hospital. According to the assessment of the hospital response capacity, we saw a few gaps that require improvement. First, the front desk. There's no separation of patients with respiratory syndromes. So all patients are in the same physical environment when they come in. And for a classification, we don't have an algorithm or a triage questionnaire, and there is no physical barrier from the front desk to the classification area. Our nebulization room has no doors, so aerosols can spread throughout the halls of the hospital. There's no tool to identify employees with signs and symptoms of COVID-19, either suspected or confirmed cases of COVID-19. So after identifying these gaps, we found the following improvements should be made. About social distancing at the front desk. We are a pediatric hospitals and children always have someone with them. So we isolated one chair and we established a 1 meter distance between people. And we started with a questionnaire of signs and symptoms, asking about respiratory symptoms and COVID-19 right at the front desk. We also put some glass doors in our nebulization room. And we know that although nebulization is contraindicated, in a few cases, we need this, and we don't have pressure inhalers at our hospital, the reverse flow closed loop system. So we requested the purchase of physical barriers for the front desk and the classification room. And we defined internal flows, and we established a respiratory infirmary for suspected and confirmed cases of COVID-19. And we also implemented a digital form that enables us to report the cases in due time. So this is our front desk, the reception room at our unit. So all patients with all different types of diseases wait for service here. And the employees, as you can see, are not protected with a barrier. So we requested a barrier to be put here. And also the risk classification room, healthcare professionals are quite exposed, as you can see in the picture. And this is the questionnaire that we started using in a partnership with our technical support. This is being used for screening now. It has 4 questions about signs or symptoms, whether they had contact with suspected or confirmed cases of COVID-19 at home or at work. And this is our nebulization room. You can see the glass doors have already been installed in this picture. And on the right-hand side, our respiratory infirmary. This is what we know here in Manaus as the pink room. So this is the form that we implemented, an online form. Employees access this form through this link or this QR code. And then in the form, they can report whether they had contact with cases of COVID-19, if their family members have had it, if they have been vaccinated or not, and whether or not they've had symptoms of COVID-19. Routine testing of healthcare professionals. You know, the professionals come to our CCIH when they have had contact with patients with COVID-19 or when they have signs and symptoms. Then they will give an interview to our CCIH physician. We will collect a sample for an RT-PCR, and then the employee is taken away from work and sent to our basic healthcare unit to continue with their treatment. Challenges to be overcome and next steps. Right now, we see a resistance from healthcare professionals in practicing hand hygiene. We want to intensify hand hygiene practices, and we want them to wear PPEs and adhesion to our Adorno Zero program. So wearing no accessories at work. That was all. Thank you very much for your attention. Thank you, Evandro, for your excellent presentation. Moving on with the presentation of our next speaker, who will share the progresses made at the Vila Alpina State Hospital. After this talk, we're going to open for questions for both speakers. So now, progresses made at the Vila Alpina State Hospital. I'd like to invite Juliana Salles de Carvalho, an infectologist working at the Vila Alpina State Hospital, to share these progresses with us. Juliana, can you please introduce yourself? Good afternoon, Milton. Can you hear me? I can hear my own echo. Good afternoon, everyone. I'm Juliana, an infectologist. I work at the Vila Alpina State Hospital and at the São Camilo Network in São Paulo as an infection control agent. So I'm going to share my presentation now. Let me see if I can do it.
Vocês conseguem enxergar a apresentação?
Can you see the presentation?
Não, acho que já colocar na forma de apresentação. Ok.
We can see it now.
Bom, a apresentação do progresso, não é? No nosso hospital em parceria com o projeto.
So the progress made at our hospital together with the PREV COVID BR project. This is our team. On the right-hand side, you can see a member of our SCIH, Dr. Ariane, Dr. Regia, and myself, the nurses Diane and Elaine, and our administrative technician, Sylvia. And here are Ana Beatriz and Ariane are two support technicians. This is a secondary care hospital, a state hospital with 219 staffed beds. Of those, 38 ICU beds, 50 COVID-19 admission beds, and 40 beds for COVID-19 adult ICU. And these numbers have been changing every day to meet the demand of our municipality and of our state. As I said, this is a secondary care hospital with the major specialties, medical clinic, surgical clinic, orthopedics, urology, massology, and OBGYN, and pediatrics. We refer high-risk cases to a regional hospital in the East Zone. In the Infection Control Commission, we have 2 nurses, 3 physicians, 1 administrative assistant, 2 technical support people, and 1 young apprentice. And we also have someone in charge of the epidemiological vigilance. Before COVID, we would report about 30 different types of diseases a month. This was actually a compulsory type of report that was part of our routine. Now, about the gaps identified in the first stage of the project, we identified that all healthcare professionals, including the support team, were not trained to recognize COVID-19 symptoms and identify signs and symptoms. So we conducted a training course for all healthcare professionals in all shifts, you know, night shifts, day shifts. We had different groups being trained. We conducted a training workshop in which we talked about the signs and symptoms of COVID-19. We had a quiz, we had activities for them to discuss in small groups whether the signs and symptoms of a hypothetical patient could be COVID-19 or not. And then they got a certificate saying that a unit participated in the COVID-19 training workshop. It took us 2.5 months to provide the training to most of the Vila Alpina Hospital professionals. These are pictures of our training course. Here on the left-hand side, you can see our ER observation activity, and on the right-hand side, administrative professionals being trained at the entrance of our outpatient clinic. So 396 professionals were trained. 56 of them were nurses, 25 physicians, 10 were physical therapists, 157 were nursing technicians or nursing assistants, other professionals 41, administrative personnel 84, hygiene and cleaning 19, and security guards 5. Then the other gap that we found in the first assessment was about respiratory hygiene and cough etiquette. We had no visual signs in all the entry areas, waiting areas, and elevators. So we devised a project and we created these posters, and we also purchased these tripods. On the right-hand side, you can see one of the signs that we created at one of our hospital entrances. So we printed 8 posters in total at the employee entry, at the employee center that is on the other side of the hospital, at the entrance to the ER, at the entrance to visitors and family members or friends, at the corridors covering the adult ICU and pediatric ICU, at the admissions and the admissions floor and the COVID-19 ICU floor, at the waiting room of the maternal child ward, and at the corridor of the maternal child ward covering OBGYN, ER, and the neonatal unit where we have our delivery rooms. Then about other gaps identified. Another gap was a lack of a process to identify patients hospitalized with COVID-19 symptoms. We did not monitor whether or not these patients presented with COVID during their hospitalization. So we started with an active search that was conducted by our nursing staff. This was available on the hospital intranet, so it was easy for them to find. They would just access the intranet and click on new coronavirus. And the first item they would see is this item that says active search, and the intranet also has all documents about COVID-19 available for them with guidelines and how to act in case of death. And then they have a form like this per patient with the date, and the nurse will then check whether the patient has any of these signs or symptoms. If 2 or more of these signs or symptoms are clicked, they will isolate the patient and will get in touch with our infection control center. And if there are people who are in touch with them, they're also isolated. If there are no signs or symptoms, they will be surveyed every day. So this is for all patients who are not hospitalized for COVID-19. But in the last month, very few patients have been hospitalized for other causes that are not COVID-19, but even so, we still have this active search ongoing. Now we have an ICU for non-coronavirus patients and an ICU for pediatric patients. About the monitoring of these patients, we first identify, so these are for non-COVID-19 patients who are hospitalized. In February, from the 1st to the 28th of February, we assessed 842 patients, and there were 10 suspected cases. So this is for the non-COVID-19 admissions. For the ICU, non-COVID-19 ICU, we had 333 patients that were surveyed day in, day out, and we identified 6 suspected cases. And for medical clinic and surgical clinic, of our infirmary units that were identified as people who had contact with COVID-19, 4 suspected cases. Now, about confirmed cases. So, of the suspected cases in medical and surgical clinics, 2 of them were confirmed among the 10 suspected cases. For the non-COVID-19 ICU, of the 6 suspected cases, 2 were confirmed. And for the hospitalization for medical clinic and surgical clinic, 2 of the 4 suspected cases also had a positive PCR. So this shows that our infirmaries are quite risky. They can have up to 4 patients, and our ICUs have 10 beds, but all of them are open. So challenges to be overcome and next steps. We are seeing an increase in the number of cases. So we have devised a new flow and we restructured our ER. We closed the door for the community and we referred patients elsewhere. And now the flow for respiratory symptoms patients was completely changed. I mean, we separated COVID-19 patients from other types of patients. We redevised this flow, but this is still a challenge to be implemented. Now we're opening COVID-19 beds in other units, not only the 4th floor, which is where we have most of the patients, COVID-19 patients, we're also opening a new ICU and the ER as well is seeing more and more cases. Now endoscopy and the outpatient clinic, they are all being replaced with COVID-19 beds as well. So we need new healthcare professionals. We've had a high number of professionals leaving. We had to hire temporary workers. We only had 20 adult ICU beds, and now we're achieving 40 ICU beds for COVID-19. So that's why we need to hire new professionals to meet this demand. Also, we have scarce products, not only human resources, but also, you know, the whole structure is overwhelmed. Inputs, it's really hard for our social organization to acquire sedatives, mainly right now. So we're checking on other options and equipment per se, or medical devices. We had a hurdle every day with healthcare and support teams to check on how things are going every day. And we have only reactivated our crisis committee, which was having weekly meetings, and now we have made this into a daily meeting because of this whole collapse of the healthcare system. We're running out of time, so if you could please just move a little faster and try to close your talk soon. Sure, this is my last slide. So, monitoring of professionals and monitoring of visitors and family members, but for now, visitation has been suspended. when we reopen non-COVID-19 beds, we have to think of that. And now hospital-acquired infections in COVID-19 patients and resistance to antimicrobial pathogens. That was all. Thank you very much. Thank you, Juliana. Thank you for your presentation. So now we're going to have a debate about the concepts covered in Juliana's and Evandro's presentations. So now I'd like to invite Elizabeth Bancroft from the US CDC to take part in this debate. Elizabeth Bancroft. She is a medical officer and epidemiologist leading the team to implement an international infection prevention and control program. She's of the Quality and Healthcare Promotion Department of the CDC in the US. Welcome, Elizabeth, to our debate.
Thank you so
much.
much.
About these last two presentations of our colleagues.
Yeah, it was fantastic, the presentations.
Elizabeth, gostaria de ouvir a sua...
Elizabeth, I would like to hear your opinion on what the two last speakers talked about, the challenges that they have identified, especially now in this context in which hospitals here in Brazil are overcrowded, and this new wave of the pandemic right now, and the challenges of infection prevention and control practices, please.
Sure. First of all, I want to thank Juliana and Evandro for the fantastic presentations and for being so open with us with the challenges that were faced in the hospitals. I know it's not always easy to do that. I was really struck by the second presentation. I have lots of notes that I've taken down, but I'll start with Juliana's. I was at first very interested in the work that you had to do to two parts in particular that you presented, that you had to do. It took 2.5 months to train the healthcare workers, right? And yet now you are having to bring in new healthcare workers. And so I can imagine the stress now of having to retrain or train for the first time new healthcare workers. So that just adds even more stress to the system. So I actually had a question for you: is how are you developing education, or have you found new ways of developing education that is short and to the point for the healthcare workers so they can learn quickly what they need to know? That was one of my questions. It really struck me, you know, looking at those two points that you presented and how they interact with each other. And the other question I have for you also is, you know, from a CDC point of view, we at CDC, and we work closely with WHO to help produce general guidance material, general education material, even sample posters. WHO has many of them. Did you, when you made your posters, and I like them very much, I saw the pictures of them on the tripod and everything, did you feel that you had enough support or enough resources from organizations to help make a poster, or did you feel like you had to make your own from nothing? You had to create everything yourself to make these important reminders for the public and for your staff? So these are my, not so much a debate, but my questions to you, my reflections that stand out.
Juliana.
And then afterwards, I will ask questions of Evandro, if I may.
Sure. Juliana, quer responder?
Juliana, would you like to answer that? So first, I will talk about the challenge of training our new healthcare professionals. So we have an onboarding routine to all new healthcare workers. This was affected by the pandemic, unfortunately. We could no longer have in-person activities in auditoriums. So this is something that we keep on doing, but a challenge that we haven't yet defined about the new onboarding protocols for new hires, especially if you have a temporary contract, 3 or 6 months contracts. So internally, with the bloodstream infections challenge, we defined an annual training schedule, but I'm sure this is not going to supply this turnover that we have of employees. So this is a gap and challenge we're still facing. Now, about the posters, we had a different type of visual communication already. So we only enhanced that previous poster with the participation of the managers of our public-private institution and the teams that are, part of our hospital. Our hospital has public beds, but a private management through our social organization. So we did not start from scratch. We had this previous work that was, led by the infection prevention and control team.
Very good. Thank you. Just earlier today, I was listening in on another panel sponsored by PAHO, and I heard something similar to what you said, Juliana, that all this social distancing has affected good training because you can't have in-person training with lots of people anymore. And so it's something I hadn't really thought of until today. And thank you for bringing it up. I think it's so important, hearing this multiple times and figuring out the best way to get training, because if you send people home and say, go watch this video at home, they're so tired after work, they're not going to do it. Yeah. Okay. Thank you so much for that. I know we don't have much time, so I'm going to go back and forth if I may. Evandro, I was also very impressed with your presentation. You came with a lot of good observations and some good data for us. I enjoyed very much, you showing all the pictures of the areas in the hospital and the changes you made to, like, the nebulizing room, the emergency triage area. And you could really see how you thoughtfully also discussed how when a child comes to a hospital, they're always with another person. When an adult comes to the hospital, you can separate them from their family, right? And just have the adult waiting in an emergency room. But a child will always have an adult. So you have to take that into account as you're making the social distancing, that you have 2 seats together always, because you always need an adult and a child together. So I liked that, that what you brought to us, recognizing that for children's hospitals, one has to adjust recommendations. One thing which you presented, which I'm sure that I was going to ask about, or that people are going to ask about, is the switch in the male-female gender in terms of who's getting the infection in 2020 versus 2021. Is it because already so many of the women have gotten the infection already, and they might be a little bit, immune to a new infection that now it's going through the men? Or what do you think causes that switch in the change in gender getting the infections?
Pois bem, a nossa grande demanda de profissionais.
We have a high demand of female healthcare professionals. I mean, we have a high number of female healthcare professionals. And in the first wave, they were hardly affected for that. That's what I think.
So in what you showed us, it looked like more females got sick with COVID in 2020. And then in 2021, it's been more males, right?
Sim.
Yes. So is it, and I was amazed when I added up you actually had 498 already healthcare workers from your facility. sick with COVID. How has that been for you to see so many of your fellow colleagues get sick with this disease?
É assustador, né?
It's scary. Thankfully, we only had 2 deaths of those 498 people, but that's quite alarming and scary. When you have to make decisions and decide training sessions, I have to say this is a great challenge. It's very complicated to see your colleagues getting sick, going through that, and sometimes you feel helpless. You can't do more for them. It's horrible.
Thank you. First of all, I want to give condolences for the losses in your facility. I can't imagine what that's been like to feel like that, and perhaps especially with the new variant virus coming, to feel like this isn't ending, you know, that this is just continuing. And I'm struck by that also with Juliana's presentation, the fact that now more and more beds are opening up, more wards are opening up to take on more patients. It seems like it isn't ending. And so I just want to express my condolences and my support for what you're going through, and recognize that you are heard obviously in Brazil, you know, but you are also heard internationally. There's a lot of people who understand the struggles that Brazil has been having with COVID. So thank you for that. Thank you for responding honestly. With that, I realized that we didn't have much time to chat because it's 3:30, no? And I want to be respectful of all the healthcare workers and their times because they probably have patients to see. So I'll turn it back over to Milton.
Obrigado, Elizabeth, pela manifestação, pelas...
Thank you, Elizabeth, for your questions and your comments. They are always very pertinent. So just a final question about Evandro's presentation. Evandro, I'd like to hear your opinion. What is it like for the CCIH to assess suspected or confirmed COVID-19 cases in your healthcare team? So this is a pediatric hospital, and in the flow that you showed, this initial assessment will go through this hospital infection control center and not like an occupational health center. Don't you think maybe there is an opportunity for improvement there in this procedure, considering that in your service flow, everything is focused on this center? Yes, right now, our hospital does not have an occupational health center. So our infection control center had to embrace yet this new responsibility so that our professionals would not be left, you know, unsupported. So that's why this initial service is provided by the CCIH, but then the professional is referred to our basic healthcare unit to continue with the treatment. Okay, we're out of time, so we need to wrap up. And I'd like to invite Carolyn for her final considerations. Are you here, Carolyn?
I am
Are you with us?
here. Thank you. Can you hear me?
Sim, okay.
Yes. Okay. Thank you so much, Milton. Thanks especially to all of you for attending, to everyone who presented. Each of those presentations were really phenomenal, so thank you. We want to send a reminder to please complete the survey. There's a link to the survey in the chat box. And after completing the survey, you'll receive a certificate of attendance. And we'll have another webinar in May, so please join us then. we'll be sending out information about the date and topics very soon. So thanks again for attending, to our presenters, and echoing what others have been saying. Thanks so much to you all for all your hard work, and hoping you stay safe. Thank you. Obrigado.